Hi, everybody. Welcome back to National Association of Adoptees and Parents Adoption Happy Hour. My name is Greg Gentry. I'm a domestic baby scoop era adoptee from California, and I'll be your host tonight. We're excited to have a really dynamic guest here to speak about a really important topic. And before we introduce her, we do want to go ahead and run through a couple of our guidelines that we follow while we're in the group here. So a reminder to please remain on mute. Raise your hand on screen or on the virtual hand so we can see that you may have a question. This is during the Q&A portion after the recording. And please do post comments in the chat. Those are a vital source of the dynamism that takes place in these conversations. If you are experiencing a serious mental health event or suicidal thoughts, please contact a licensed professional or the National Suicide Prevention Lifeline by dialing 988. Reminder that this is a public meeting with no guarantee that information or identity is confidential, and portions of this event are recorded, may be shared in our private happy hour group on Facebook and our YouTube channel. So we've got, again, as I've mentioned here, a really exciting guest to speak about an important topic. And let me introduce Dr. Maria Cronyn to you and tell you a little bit about her. Dr. Maria Cronyn is a naturopathic doctor with over 26 years of clinical experience. She's the founder of Adoption Evolution, a 501c3 established in 2025 to advance education, validation, and advocacy for individuals impacted by adoption and foster care, while transforming how professionals are trained to understand and treat them. Adopted at birth during the baby scoop era and discovering her adoption at age 11, Dr. Cronyn brings both lived and professional expertise to her work. She's the author of Adoption Evolution, A Call to Action, and her newest book, Shapeshifter, Because I'm Adopted, which explores integrative mental health through the lens of adoption. Dr. Cronyn, thank you very much for joining us. We're excited to have you on the happy hour.
Thanks, Greg. That sounds great.
So I'm wondering, I think just for a way of a brief introduction here, would you like to share maybe a few minutes about your adoptee story? I know you mentioned in your introduction here that I just read you discovered at age 11, so it can be considered quite late. I
Yeah,
understand that as someone who found out at age 10, and I'm sure it had a very formative impact on you. But maybe just a few words about your experience of being an adoptee.
sure. I had no idea until age 11. It came up very accidentally, and I was told very matter-of-factly, and we really didn't want to talk about it again. It was quite a shock. I had like an aunt and an uncle who talked about it a little bit with me, but like what I write about and what I talk about with my patients now, that's what they were told to say, right? They were told to even lie, and they didn't know what to say. So we really didn't talk about it, and that's what I think all adoptees experience even now is we don't know how to talk about it. And back then we definitely didn't know how to talk about it. So it's so hard to articulate. I call it unspeakable, inarticulable, because it's everything. And it's so hard to find the right words, and you go into different chat rooms and everybody says, does somebody else feel like this? And I made a post about it. I made ChatGPT make an image where there's all these people out, and a person is like, does everybody feel like this? And it's like, me too, me too, me too.
You,
We're
right?
having our own Me Too movement, I think, now that we're all getting together and realizing that we all have some of the same feelings.
I feel like all of that's so relatable in the same sense that my own parents, my adoptive parents, also never never had a conversation with me about it other than the initial one where I found out I was adopted, and that was also very accidental.
Yeah.
And it's kind of striking. I would say it was a detrimental thing not to have any space for being an adopted person. And I
Yeah.
know there are parents who probably are more strict about not speaking about it than others. In my case, they weren't strict, they just got very emotional. And so I would drop the subject with a few times it would come up because I didn't want anybody to cry. Um, and I didn't want to feel bad about it. So I shouldered a lot of it. But it sounds
Yeah.
like the experience for you. was also very startling and
Never talked
no
about it
outlet for
again.
it.
Yeah, we never talked about it again. I had a real duality in my life with everybody that I met outside of my home. I told I was adopted from the minute that I found out, essentially. And I wore it like a superhero cape, but nobody knew what to say when I said it. Like there was just nothing to say. Nobody knew how to talk about it. We didn't know what to say about it other than, sharing our stories. I remember young friends of mine, and we were like, I'm adopted. Yeah, I'm adopted too. And then it just sort of ends,
Yes.
right?
Yeah,
We
one of
don't
my
quite
very
know
best
what to
friends
say
in high
about it.
school.
We felt very lucky, right? Um, it's just, it was a conversation starter, I thought, by me claiming this identity, but nobody ever knew what to say. So I'm filling it in now.
Yeah, yeah,
Sorry.
actually, it must have been quite a springboard for that because not only did we not have room to talk about it, people don't know how to be receptive to it, right?
Yes.
There was a whole culture that didn't have any way of processing what you were not saying about it. But like you said, the experts were telling people, don't talk to your kids about this. Don't gauge them about that. That was the expert advice at the time, and it's pretty damaging, I think.
Yeah. It comes from all that history that I had written about with, the baby scoop era, of which you and I are from, the plenary adoption. People talk about this. Children are a clean slate and you just don't talk about it. And nobody talked about it. I call it the last taboo. We don't have the words for it because nobody's been talking about it. And boy, do we need to talk more. There's a lot to it.
But would you say that for all the years that you couldn't talk about it, and I know we've had other conversations in advance of this, that a lot of people talk about being in the adoption fog and not even necessarily fully aware of what the burden is that they're carrying or the impact to them as people, that they may be in this role, that they've been put into this situation that's put all these expectations on them,
Mm.
uh, and they get very performative, and they feel like they're holding things together that young people probably should not be holding together. But did you experience any of that for yourself?
Positively. I found all the adoption community online after I moved to Arizona only about 18 months ago. And boy, did I come out of the fog hard. I had no
Yeah.
idea. I had been practicing medicine for 25 years and doing a ton of mental health and been adopted all my life. And I didn't know any of this stuff existed. And I enrolled in some courses. So, we call it coming out of the fog, right? And call it the fog. Psychologically, the term is dissociation. And we dissociate quite regularly, when you get just that little spacey kind of feeling. And that can be kind of prolonged when you're quite shocked. And we dissociate regularly. People our age will remember a silly movie, Sybil, with the multiple personality disorder, right? And dissociative identity disorder is not like that whatsoever. And when we experience a shock or a trauma, it's very easy for us to dissociate. And it could take days or weeks, or depending on how many times we get shocked, quite a while to come out of that fog. But I don't know if I ever came out of the full fog until I was 56 years old and really diving into this. Like I thought I knew myself.
And
It reframed how I look at everything and how I look at my patients now too.
it's so common in the baby scoop era for people to be about, and I've said this so many times, people who are around 50 years old or so suddenly come out of the fog, and
Yeah.
it's a real doozy. And so before the 18 months, 18 months ago, had you even thought about working on the topic of adoption or doing any work in that area?
I mean, I did a ton of mental health as a naturopath. I do a lot of homeopathy, which does very deep dives and descriptors and, origin stories and stuff like that. And I, like every other doctor, when somebody said they were adopted, but I would specifically ask about traumas and things, didn't look at adoption itself as the unique and very significant trauma in and of itself, and then everything else is after. But that is a very first position core piece of information that holds a trauma, and everything else is on top. But I was like every other doctor. I was like, oh, we don't have a medical history, but I would share. I was like, well, I'm adopted as well. I understand what that's like, but I didn't have the words either. It's
Yeah.
so funny now.
Yeah, and as you said, the community online, at least for me, same, very, very parallel for me. That's where I got language and
Sure.
conceptuality, and I found that I'd had these glimmerings of things all along that I there was no way to articulate until suddenly I was thrust into this. There were all these people around me saying the same thing or
Yeah,
something similar. I'm not saying everyone experiences exactly the same, but it was so eye-opening and it's shocking because it's not just like, oh wow, I figured that out. It's like, at least for me, it was like being turned upside down, inside out, and almost
absolutely.
like you go, what have I been doing my whole life? What do I do? So did you feel set on a new path at that point?
So, yeah, and to what you said, so I read and looked at Dr. Bruce Perry's work and things like that as well, and Oprah Winfrey interviewing him about trauma-informed schools and stuff like that. And the neuroscience behind it fascinated me, so I included that in the book as well. It's, when you're coming out of the fog, you're actually rewiring. And I just responded to somebody not long ago who said, I don't feel like I can express myself to my family. I love my children so much, but I feel like I hold back and stuff like that. Think of the word suppression. We suppress our emotions in so many ways on a daily basis from the time we're young until we're older. And it's shocking to try to imagine your neural circuits in there and how they're blocking and rerouting because you have to suppress so many things because you just don't know how to articulate all your feelings, and then you have to compensate for all these feelings and suppress a lot of emotion, and then go about the world in a normal way, and we have to suppress all those feelings. They're inarticulable, right?
Yeah, there's just no way to express them.
So when we come out of it, sort of as we're coming out of the fog, we're literally rewiring our entire understanding of ourselves and the way we look at the past. And it's difficult. It's very difficult. For me, it was very, very difficult. I was talking to a number of people, but just sort of had to take extremely good care of myself and then really take it slow with those thoughts. I did a lot of video journaling, looking at myself while I was talking and retelling. So, like a narrative therapy, which I refer to these things in the book, is very helpful. Looking at yourself while you're talking and recording yourself. It's not to replay it, it's to give yourself narrative therapy. And it really opened my eyes to the cross circuits of, like, I had a lot of blame and resentment for certain people in my life. And when I realized that adoption trauma traumatized all of us, a lot of that blame and negativity went away. And I had a lot more empathy around the whole situation because my parents certainly didn't know what they were doing with two adopted children. And I called up Dr. Boris Gindis, who's well published. He's a psychologist, semi-retired here in Arizona right now, but he worked in New York. And I knew him because I referred adopted patients to him before. And I said, Boris, this information has been like hidden. And he said, nobody wanted to know for so long. It's such a tiny specialty. But in the United States, it's many millions of people. And when you count the families, you're talking about a full third of this country. You can't just look at the adoptee, you have to look at the parents and the partner and the children and the siblings. And we're talking about we're talking about a huge amount of people. Because as we all know, the United States were the adopters. We brought people from everywhere.
Yeah.
We're talking about a lot of people affected by adoption, and adoptees are not the only ones that are traumatized. The whole family is.
Could you talk a little bit about the trauma, the way it differs for members of either the triad or the constellation?
Absolutely. I'll give you some sort of examples, and it should be very clear to everyone. When you adopt a child, and I haven't written about this in the book, but I researched primates. We're only a couple chromosomes away. If a woman with a baby dies in nature, a chimpanzee dies, the dominant male will keep the child alive and try to feed it, but he's trying to find another mother for the child. And if there is no suitable mother, or not suitable mother, but if there is no female that steps forward to bond with this baby, the male can only keep the baby alive for so long. And the reason for that is hormones. It really is. It's whatever hormonal state the woman is in. Now, when a woman adopts a baby compared to having a baby, it's two completely different states. And bonding isn't automatic at all.
Yeah.
And it can be very difficult. And it can be extremely shattering for a woman's identity to not naturally feel bonded to the child that she adopted. And she could feel so much shame, and she might be unsupported by the family. I think this is part of the reason why it's unspeakable. The intensity of the shame is profound. I've talked to so many people whose marriages broke up after they adopted a child. The man doesn't understand what the woman is doing. The woman must bond with this child because a mother is always the primary caregiver. And if they're not completely united and understanding, the marriage will even break up. And I've heard terrible, terrible stories. People who adopt have to be prepared that you are receiving a child who is traumatized. And it is 100% different from a biological child experience. In every way, it's different. And it's going to affect the entire family permanently. And the mother must be supported, and the father must be completely on board and supportive and understanding, because it's very, very difficult. And that bonding must take place implicitly. But the expectations of adoptive parents are well written about in the courses that we take for adoption competent mental health. And this information needs to be brought forward because parents need to understand, or things can go horribly wrong, right? We have so many children in the system. We have to prevent things from going so badly. So I'm on an education mission to teach this
Right.
stuff.
Do you feel like the information about trauma to the infant and even to the natural mother is getting more mainstream? Something that people are knowing more about, or not yet?
Well, I just saw a movie about it last week that was at the film festival, but I think it's the first movie. So we have miles to go, but it's coming out. And that documentary was filmed over an 8-year period of twin girls who were adopted in an open adoption. And you saw them meet their biological mother and meet their biological father. And it was very hard to watch as an adopted adult. And someone else that I know was at the film, and we're both adopted, and the director is not. And we sought each other out right after, and we were just like, wow, isn't that really hard to watch? You're just staring into these girls' eyes all the time, knowing that they're traumatized and having a hard time. And if you're not adopted, you don't understand. You can't understand it.
So true, and yet you're faced with a mission that you do want at least to build some kind of empathy and understanding in a wider audience of people in the public, and there's got to be lots of resistance, and it seems like it's maybe not just people are not informed, but they push back against this idea, right,
Right.
about trauma to the infant maybe, and um, you mentioned the blank slate for a minute here earlier, I think. And that's really hard to get that dislodged from popular ways of thinking. It feels like
Some people are not going to change their mind, and it's very unfortunate, of course, because they're just categorically uninformed, and they have to try to at least understand if they're in, relationship in some way to an adopted person, hopefully, because that's what we grow up with, right? We feel like a stranger in our own family that we
yes,
grew up with. They don't understand us. And I had an adopted brother, and I didn't understand him either. And he
yeah,
didn't understand me. We don't
yeah.
understand one another at all unless we really, really try. And we need far more research and literature to come out. Adoption itself has changed so drastically in the last 80 years with all the international adoptions that came to the United States from things like orphanages. And now we have this modern day foster care system, and it's continuing to evolve. And the research has been around for a good 20 years, and we must disseminate it much, much faster and talk about the trauma because now I'm a naturopathic doctor, and some people here may not even know exactly what I do. I'm trained as a primary care physician. I can prescribe medication as well, but I have extensive training in all kinds of natural therapeutics to deal with, common ailments. But I can give you a vaccine and give you a drug too. But I think a lot of people would love and say to their doctors all the time, can I do something natural? Yes, you can. And I'm the expert in that. When we are adopted, when we are young, we will show behaviors that can look like a lot of other things. And today, so I practice medicine now for 26 years. 26 years ago, we didn't even have the autism spectrum diagnosis. We had hyperactivity creeping up in large numbers. Now we have so many psychiatric medications and so many more refined diagnoses. Adopted children are diagnosed with a number of things and given medication at a very early age. What the training says, almost you have to wait to the end for them to say it. When you have potentially a diagnosis of trauma in a child, very specifically says, look no further for another diagnosis. Explore the trauma, be with the trauma, have all the trauma-informed care, but look no further for another diagnosis. I know I've spoken to so many adopted people who were given a diagnosis of reactive attachment disorder, and they are morally injured by that diagnosis. And you know what? They kind of should be, because there's nothing wrong with us other than we're traumatized, right? And
Yes.
people are diagnosed with ADHD, and people are diagnosed with reactive attachment. And the diagnoses are often to give them a medication. And we have such a hypersensitive nervous system from the trauma. These are the cases that don't respond to medication. They, in fact, get worse. So if we don't stay with the diagnosis of trauma and we don't medicate, we're in a much, I don't know if I just said that right. If we stay with the diagnosis of trauma and we just work with the trauma rather than explore medications, often we're better off as long as we have what the parents need to do is co-regulation, understand the trauma, work on themselves within the family with the child. Because medication in this hyper aroused state that adopted children are in, traumatized children are in, medications can go quite wrong very easily.
How prepared are um, healthcare professionals right now to understand and deal with what they may or may not know is happening in adoption? What level of training do they receive?
None, none really. Every one of us knows because we've done it a million times. You check the box that you're adopted, you have no medical history, and every medical professional you have ever met has just moved on. Right?
Yeah,
And I aim to change that right there. And I was a primary care physician taking insurance in Vermont. It should be a drop-down menu right in your electronic health record. When it says adopted, your primary care physician and pediatrician should say, adoption? Oh, okay. Look right at the patient and say, I understand this trauma. I'm terribly sorry. I know this is very difficult. I'm going to give you the right referrals. And then, depending on the age, talk about the risk factors of addiction, problems with mental health, and ask about them right in the pediatrician's office and explore that. That's my mission, honestly. And I mean, the training has these videos where there's mental health providers who don't even have it on their questionnaire, and they're talking to teenage interracial adopted children, and they don't even know that they're growing up in a family that has, three adopted children of all different races. That just can never happen. It can never happen. So every mental health provider, every primary care physician needs to know that this is a significant trauma because it's not in the ACEs list. Do you realize that? Adverse childhood events, it should be the first thing, adoption or history of foster care. It should be the first. Is there a bigger trauma other than death? And as adopted people, being adopted, it's like your biological family is dead. You've not met them ever, and you may
yeah.
never. It's like death in our young mind. So I'm trying to fix all that. I got a public
That's
health grant. I wrote it as a
okay.
public health emergency, and I got a good sized grant. And she said, "You go out there and you get your collaborators, and you make this right." I was like, "Okay, I'll do my best. I need more money though."
Did you find that it was hard to convince someone to invest in you that way and what your mission is?
No, no. When
That's
I've spoken to Mercy Care here in Arizona, and they put me in touch with Department of Child Safety, and I've talked to a number of behavioral health centers, and they get it. These mental health professionals are like, now that you've said it, I completely understand exactly what you're telling me. And I am thinking of cases, and you're 100% right. I was speaking to an addiction treatment facility, and I gave them, the statistic we all know about 40% or so of your inpatient addiction treatment clients here are probably history of adoption or were in foster care. And then I elaborated on the trauma and how addiction is so high because we're self-medicating, because we have this perpetual state of hyperarousal. And then when we hit teenage years, I mean, I know for myself, I was an insomniac of a child. And then once puberty hits, and I write about this in the book a lot, it's chemistry. Once those hormones start to really go crazy, you look for things to self-medicate because you're just bouncing off the walls, or you're so depressed you kind of can't function either. And that's when the addiction will take, really root. And the whole room of addiction treatment mental health professionals was like mouth open, going, "Oh my God, you're so right. Do we even ask that question about these people?"
Yeah. Do you feel like people who do intakes are most likely the ones to be aware about the prevalence of this?
And it's one thing to ask a question and start taking numbers. It's another thing to know how it loops into recidivism, and for the person to understand and to really validate that person and say, look, you've got trauma that you haven't even explored that is feeding into your addiction. Let's get a hold of this and start talking openly about a trauma that you don't really fully acknowledge that you have and what could be driving your whole addiction process. right?
Yeah. How has it been received getting the word out there so far?
Excellent. Excellent. I can't be in a million places at once. I wish I could. But you're taking a video and you're going to disseminate this. I mean, we all need to know this stuff, right?
Absolutely.
Primary care physicians, all the mental health professionals, pediatricians, even. When your child is 10 and they're adopted, you need to know that once puberty kicks in any minute now, they're going to be potentially looking for substances and everything else because they are uncomfortable. They don't know how to articulate how they feel. You need to know this before puberty hits because puberty's hard enough on everyone. So yeah,
How
it
does,
makes sense. Once I explain it, it makes sense to everybody that I've ever talked to. I've never gotten blowback. I see online people getting spoken down to and
yeah.
called ungrateful or some nonsense like that. But when I break it down to medical professionals or to every patient that I've ever had, nobody has ever contradicted what I've said. They've had their eyes opened and they're like, oh my gosh, of course.
Can you talk a little bit about your books and what role they're playing in you getting your message out?
Yeah, so like I said, I got a public health grant because my little book, um, which is named after my nonprofit, Adoption Evolution, a call to action, is about those statistics and some of the history. And I even say that the baby scoop era should be designated as a historical trauma because it's so significant. Because now we have multi-generational um, adoption trauma, and we know now that intergenerational trauma is a real thing. It's totally real. Intergenerational trauma, experiencing the trauma of your parents, potentially your grandparents, goes on inside these children. That's why you're seeing all these behaviors, right? Um, and we certainly did not pay any attention to that. And then my second book, because I've been practicing naturopathic medicine for all these years, I called it Because I'm Adopted, Shapeshifter, because I'm adopted, because I realized I spent my entire life looking for things to treat myself, and then I made it my life's work in naturopathic medicine because I went to a tremendous naturopathic doctor that I found when I was about 25. And it felt like the first time I actually was fully in my body and felt peace. And it was through natural medicine. He gave me homeopathy, changed my diet, and 6 weeks later, he gave me some herbs, and 6 weeks later, I felt better than I had ever felt in my life. And I said, there's definitely something to this because I've never, like, I really feel like I entered my body fully and I slept perfectly and I could understand my health so much better. And he educated me on that. And it was fast and easy. And I didn't have an ache or a pain. And I slept through the night. And I went off to naturopathic medical school. So I realized I spent so many years of my life because I'm adopted looking for remedies to things that I had experienced, learning to take very, very deep dives and treat the individual and not just, oh, you have a headache, here's a pill. It's all in the story. And I've always spent so much time with my patients, and I use homeopathy because it is all in the individual's, you know, you can ask an adult their, birth history, like being adopted on an intake form when you're a homeopath. Because if there's birth trauma, you want to know about it and you want to treat it. Homeopathy is that specific, and I feel like that's why I gravitated to it. Although it really drew me in because, and adopted people will understand this, how unusual it is. It felt like I had done it before, which is a rarity.
Yeah.
But I was in a room, rooms full of people who are trying to learn homeopathy, and they're looking at me going, "How do you retain this so easily? How do you understand this so completely?" I'm like, "I swear I feel like I did this before." So I wonder if there's not a homeopath in my ancestry.
Very interesting.
And it was a very welcoming sense of deja vu. And I realized as I was writing the book, because I'm like, what am I going to call it? And I'm like, because I'm adopted, I did all of this potentially, seeking my own self-care, deciding to study medicine, seeing my family struggle. I always wanted to fix them.
Mm.
I was always going to be a doctor or something in medicine, I feel. And then finding natural medicine because nothing had worked for me before. I was so sensitive. I had like eczema and asthma and stuff like that. I was so sensitive even to fragrances. And I think many, many adoptees are that sensitive as well because
I
we have
am.
this trauma. So your digestion and your respiratory system, and you can have tons of histamine. Like I used to get hives so easily. That's based in the neurological sensitivity. It makes everything super sensitive. So everything is off. You're just sensitive to the whole world. We're all incredibly sensitive. So we're sensitive to medication and we're sensitive to foods. And like you could have a mild food allergy, but in an adopted kid, it might be very bad. They feel like they can hardly eat anything. They always have a stomach ache. I felt like I never slept as a kid.
Mm.
And when I look way back to what I used to eat when I was a kid, I'm like, no wonder.
Uh,
I was allergic to eggs and milk, ate them and drank that every day. Everything was just so sensitized. And that's what we need to understand. So I write a lot about self-care and like we all need to take a very good methylated B complex. I wrote that in the book. Always. A good multivitamin, just some basic self-care stuff will take you very, very far. And then some more specific things about hormones and progesterone in particular for men and women, and how as women age, I call it menopause, I call it the cliff, because we kind of struggle with our hormones all of our reproductive years. And then when your hormones start to dip when you're an adopted woman, these could be potentially the most severe cases of mental health crisis almost. And I've said for many, many years, hormone health is mental health. And it's very, very true in adopted women. You can feel like you're really losing it.
that's very, very important
It's
for
very
someone we
important.
know.
And we
Wow.
have such an epidemic of psychiatric medications being prescribed. And you could be taking, Zoloft, very common, right? What you need are hormones. You're not going to get hormones from Zoloft. You're not. You're not getting the right thing that you need to sleep and feel calm and feel rational and sane and remember things properly. It's drastic. Although hormones are catching on just this year, but many, many more women need to know that. But we're affected by our hormones much younger than that as well. When I mentioned puberty before, um, adopted women tend to be estrogen dominant all our lives because we have so much adrenaline, so much cortisol. It steals progesterone, which is a really calming hormone. So women will be estrogen dominant, making them more prone to exquisitely painful periods, maybe even endometriosis. And I know there's women out there going, yep, yep, yep. And progesterone is something I wish somebody had given me an industrial sized vat of progesterone cream when I was a teenager to help me because I had pain and these are exquisitely painful and horrible periods that women will struggle with. So it's hormonal. It's the cortisol, it's the estrogen, it's the way we're wired and how we burn through our nervous system gets so sensitized and it's hormonal and it's all these things that I've been doing as a naturopath for years and still not fully understanding until much more recently that when you treat the trauma, perhaps things will unfold even better. Because and especially now, we're essentially in a mental health crisis in this country. So when I say, it's a full third of this country are related to this situation, and then we have all these medications that are poorly prescribed, no wonder why we have a mental health crisis. We're never given the right things. We're not talking about exactly the right thing. And how are we going to get to the bottom of it?
Your message, in addition to you taking it to the people who are in the therapeutic spaces, there's also a larger or a broader social message. Because as you said, we're talking about a constellation and people who are affected across so many layers of this. How does the message get to the wider public then? Do you have any ideas on how that can be done?
Well, I mean, I'm trying as loud as I
Yeah.
can. I'm trying to create, the adoption diaspora. We're
Oh, can you talk
we're
about it?
like
Yeah.
a we're like a we're like a monolith, with our families. If we can all get on the same page, we're such a huge number of people, and if we can get enough information circulating within our families and within the schools need to be much more trauma informed too. If we can all get on the same page as fast as possible, um, I think we would all have a much better understanding and it would turn around very, very quickly. But
Yeah.
particularly the young generation now that is being medicated, misdiagnosed. As a naturopath in particular, I really feel for that situation because we have so many medications now. And these kids are pumped full of them and they really lose themselves and then wind up addicted. I see it all too clearly. And we need
Sure.
to really, everybody needs to be screaming about this and teaching one another. And we have this situation. One thing I definitely want everyone to hear is that we have to take far better care of ourselves and take responsibility for our own health. Everybody loves to talk about self-care, and I'm a doctor. I know people seldom understand what that means. We have to take much better care of ourselves because what jumps out at me about the statistics about addiction and mental health and even homelessness and incarceration is that we have to understand ourselves much, much better, meaning we have to understand that we have probably a complex PTSD from childhood and it's going to surface. So we have to take much better care of ourselves and we have to understand ourselves. And then we have to
So,
demand from every doctor that we meet adoption competent care. We have to demand it. We have to hear about it, kind of internalize it. And, if you just heard about it now, next time you go to your doctor, be like, hey, I'm adopted. Do you understand what that means?
yeah.
We have to demand it, and that will make it happen faster too.
What do you think adoption competent therapy looks like? Well, and I use the word therapy loosely here. I don't necessarily mean mental health professionals, but
Well,
adoption competence or adoptee competence, even more specifically.
there's a standard of care there that mental health professionals, they've already learned the strategies, they just have to learn how to apply them. I want to take this one step further as well because I'm a primary care physician. Um, my latest adoptee in my practice, I immediately, the first time I met him, sent him to neurology. This is neurological. You can't talk your way out of this. You have to link the body and the mind. And sometimes there is even damage to the nervous system that might be visible on an MRI. We are not in great health, possibly all the way to neurological. You can't just talk about it. You have to take better care of yourself. You have to try to find ways to articulate to your doctor if you're feeling what could be neurological, not just psychological. right? Everybody thinks everything is psychological, and this man described a symptom to me that was essentially a hallmark symptom of multiple sclerosis. He said, I get an icy cold feeling from the tip of my tailbone all the way up to my head, and I start to tremble. And it happens several times a month. That's called Lermut's sign. And he might have actual nerve damage that we could see on an MRI that would give him a diagnosis of multiple sclerosis potentially. That's how stressed out our nervous system is. It's written in National Institute of Health papers that adverse childhood events can contribute and cause multiple sclerosis. We get so stressed out as kids, our nervous system is on fire. We could literally have nerve damage. It's not just psychological. We don't have just psychological problems. We are so stressed out from a young age, it could cause very physical problems.
It's very,
Did
very
I just,
sobering to
did
think
I just
about.
blow your mind a little bit, Greg?
Um, I
Did
think I've
that
been
kind of blow
hearing
your mind?
from advocates about certain things that always are going to expand my awareness of this and
Yeah.
rightly. So yes and no, I would say. I've certainly been aware of elements of it, but this is a very informed perspective also that you're providing on what you're seeing and the way that people can advocate for themselves becomes pretty paramount too, I imagine. You're right. You said, I'll go into the doctor and I'm going to tell them I'm adopted. Do you know what that means? Do
Yeah.
you know what that's
Amanda.
the implications of that are? Are you going
It's a whole,
to?
in naturopathic medicine, we have this oath where we treat the cause and you look at everybody as a total individual, the totality of their symptoms, but it's also complicated, right? But when you meet, it's what I'm saying is it's body, mind, and then spirit. You have to treat your body right, or your mind is never going to be right. Everything is not psychological. Everything cannot just be talked around. You could have some real physical stuff driving some very serious psychological problems. And it could be hormonal or it could be neurological. And it's not going to get better with talk therapy.
Really important points. Thank you.
Yeah. Tying the body into the mind and going into your doctor and saying, look, I think my adoption might be causing me to have some pretty severe symptoms, and it could be simple stuff at first, headaches and neuropathy, you get pains and restless legs and stuff like that. Pay attention to that stuff. I'm saying it now. The light bulb must be going off over a couple of people's heads. It's definitely true. Your body and your mind are not separate, and trauma can do serious damage to your body. And I know we're all a little bit morally injured because nobody pays any attention to our biggest problem, which is our adoption trauma. But we have to have the courage to go to the doctors, right? And explain how we're feeling because maybe we need to be checked out. So many people, the other thing that jumped out about the statistics was so many people looking for help and not finding the right help because I wrote a story in there about, my own bad experiences for years with mental health professionals and how I wound up in naturopathic medicine because the doctors weren't paying attention to my neurological symptoms. And I know we're all quite morally injured often by the medical system, but this should actually make it easier, this information, because if you're at least, I'm trying to get somebody to make an app around adoption literate health and mental health so that you could just take the phone and say, look, I'm adopted. This is what this means. See, this contributes to all these symptoms that I have. I'm trying to make it better. Trying very hard.
Definitely have lots of great ideas on moving the conversation into a wider space and then focusing on where the treatment is needed and how to present it for yourself, that the 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 person who's caring for you isn't necessarily going to come up with it unless you're pushing for it yourself.
That's right. And we have such a hard time talking about it because it's such a muddled mess. I'm trying to figure out the best ways to interpret and getting the medical community much more informed as fast as possible because the statistics are outrageous in this country in particular, where we have the most of us. So I've got my mission, working very hard.
It's amazing to think that you're saying even a year and a half ago is when it really started. Look at
Yeah,
all the work you've done in such a short period.
yeah. It was a heck of a year. And now I'm haranguing Gadfly to do an in-kind grant to build me a platform with an app and everything. I'm like, come
Good
on,
word.
help out. Yeah, it was quite an eye-opener and it changed the direction of my career and my entire life. I was like, this is what I'm going to do now.
Dr. Maria Cronyn, what a great conversation. I really appreciate you coming to the happy hour and sharing so many things about what you've learned, about what you're advocating for, and what you're on the edge of pushing forward for people to have better opportunities as adopted people, to be understood, and the impact across the whole constellation. It's just been a really edifying conversation, and I appreciate you coming on very much.
Thank you. I'm consumed with all of this. I'm a head full of statistics, and I see somebody even put a post up here, and I agree with you, yes. And that's what I'm talking about, morally injured. So I'm a naturopathic doctor. I should have been diagnosed with multiple sclerosis probably before the age of 20. And I have multiple sclerosis and I don't flare. But I walked away from traditional medicine myself. So I know exactly what you're saying. Um, and I am on the inside of that, treating people correctly. And I will consult with anyone's doctor. If I have a patient, I will call your neurologist, your primary care doctor, your mental health provider, and I hope to teach other doctors to do the exact same thing so that nobody has all of these missing pieces and everybody, you need a team if you're really unwell, particularly if you're one of us, and everybody has to be on the same page. And nobody wants to take those drugs, I know.
Where can people get in touch with you in addition to your great books that are out there? Is there some place they can follow what you're doing?
Yeah, Adoption Evolution is on Facebook. I have a new website that will be coming out next week. I have, which will be linked. My website to my practice is just my name, Dr. Maria Cronyn. That's on Facebook as well. I think I've written a few blogs and stuff. You should be able to find me. Cronyn with a Y. But yeah, hopefully I'm hiring enough SEO content people where Cronyn and adoption are going to be synonymous very soon.
Great. I feel fortunate to have run across you. I think right when the 18 months were starting, right when you were moving, and I remember you
Yeah,
contacted me about something totally different. But I'm excited that we've continued the conversation and to see all the great work that you've done, and wishing you the best of success.
thank
We'll
you.
go ahead and end the recorded section of our presentation here and move to a Q&A. But again, thanks
Great.
to everybody for coming out to support Dr. Cronin and listen to her wise words of wisdom here.
Thanks,
And
everybody.
yeah, we hope to see you again on Happy Hour and other NAP offerings real soon. So next sound you'll hear is the end of the recording, and then we'll move into Q&A. Thanks so much.
Awesome. Sorry, I jumped into Q&A.